Hello students, welcome to readmedprep Academy channel. Today in Human Health and Diseases Part 8, we are going to talk about the drug and alcohol abuse in adolescence, mental health, example depression. Adolescence begins with a period of rapid physical and sexual development called puberty to maturity at age 12 to 19 years of age. Adolescence is also a highly dynamic period of psychological and social changes in individuals. There are three stages of adolescence: 10 to 14 years old, early adolescence, where they are in grades 5 to 9. 15 to 17 years old, middle adolescence, they are in the grades of 9 to 12. 18 to 24 years old, late adolescence or early adulthood. Normally they are in college or post-high school period. Our adolescent years from around age 10 to about 25 years are a period of remarkable growth and opportunity. We discover, learn from and adapt to the world around us, forging our sense of who we are and who we aspire to be. We learn to make decisions, manage our emotions, and create deeper connections with peers, others in our communities. We also build resilience and develop interests, passions, and meaningful goals that shape our adult lives. Adolescents are vulnerable to group peer pressure, and many youngsters are pushed into experimenting with drugs and alcohol. Proper education and guidance would enable youth to say no to drugs and alcohol and to follow a healthy lifestyle. Some common reasons for adolescents to try substances: boredom, peer pressure, social anxiety, trying new things in life, boost concentration and grades, for example, their academic performances, and control weight. The classification of drugs that are used by the adolescents, you can see in this table. On the left side is the group, middle is the drugs, and right side is the effects. The stimulants include the amphetamines, cocaine, nicotine, and tobacco. The effects accelerates the activity of the brain. Depressants, alcohol, barbiturates, and tranquilizers. Effects slows down the activity of the brain. Narcotic or analgesics, opium and morphine are the drugs. They act as depressants on the central nervous system. Hallucinogens, lysergic acid diethylamide, shortly called LSD, and phencyclidine. The effects, they distort the way one sees, hears, and feels. Stimulants, depressants, and hallucinogens like bhang, called marijuana, ganja, charas. Effects, stimulating action on the central nervous system and affects the cardiovascular system. Let us see one by one. Alcohol is a psychoactive drug which acts on the brain, affecting a person's mind and behavior. It is a depressant which slows down the activity of the central nervous system. The use of alcohol during adolescence may have long-term effects. Alcohol interferes with the ability of the liver to break down fat. Over time, the fat accumulation and high levels of alcohol destroy the liver cells, and a scar tissue grows in the place of the dead cells. This scarring of the liver is called liver cirrhosis. Alcohol irritates the stomach lining due to the production of excess acid leading to the ulcers. Excessive alcohol use weakens the heart muscle, causing scar tissue to build up in the cardiac muscle fibers. As a result, heavy drinkers have an increased risk of high blood pressure, stroke, coronary artery disease, and heart attack. Korsakoff syndrome, a chronic memory disorder, is most commonly caused by alcohol misuse. In this image, you can see the effects of alcohol: increased heart rate and blood pressure, diarrhea, nausea and vomiting, headache, tiredness and trembling, poor or decreased sleep, anxiety, and dry mouth. Drug abuse. What is this? The intake of certain drugs for a purpose other than their normal clinical use in an amount and frequency that impair one's physical, physiological, and psychological functions is called drug abuse. The drugs which are commonly abused include opioids, cannabinoids, coca alkaloids, barbiturates, amphetamines, and LSD. Opioids. Opioids are drugs which bind to specific opioid receptors present in the central nervous system and the intestinal tract. Heroin, otherwise called smack, is chemically diacetyl morphine. It is white, odorless and bitter crystalline compound. It is obtained by acetylation of morphine, which is extracted from the flowers of poppy plant Papaver somniferum. Here you can see in this image the opium plant, otherwise called the poppy plant. Morphine is one of the strongest painkiller and is used during surgery. It is the most widely abused narcotic drug which acts as a depressant and slows down the body functions. How the morphine acts on the nervous system? Here you can see the axon having the receptors for morphine. The morphine gets attached to these receptors, and the activated morphine undergoes phosphorylation dependent endocytosis at the presynaptic terminals. Morphine is locally recycled from a retromere marked endosome. Morphine vesicular cycle and synaptic cycle are independent. Rapid surface diffusion of morphine allows for efficient control of synaptic effectors. Thus how morphine has a very great effect. Cannabinoids are a group of chemicals obtained from cannabis sativa, otherwise called the Indian hemp plant. Natural cannabinoids are the main source of marijuana, ganja, hashish and charas. Hashish is made through separation of trichomes from the cultivated plant using various methods such as heat, ice water, solvents, pressure separations, etc. Charas is made by rubbing the tops of the live plants in the hands and scraping the fingers, the adhering resin. Ganja is the flowering or fruiting tops of the cannabis plant, excluding the seeds and leaves, when not accompanied by the tops, from which the resin has not been extracted. Bhang is prepared from the leaves and the seeds of the plant primarily. Cannabinoids interferes in the transport of the neurotransmitter dopamine, has a potent stimulating action on the central nervous system, producing increased energy and a sense of euphoria. The mechanism of action of cannabinoids you can see in the presynaptic neuron. It causes inhibition of the neurotransmitter release. It causes blockage of the neurotransmitter receptor in the postsynaptic neuron. It also causes endogenous and exogenous cannabinoids reduce the neuronal signaling. There are certain receptors in the presynaptic neurons which cause an effect by the attachment of the cannabinoids to the receptors. These receptors are called CB1 receptors. The synthetic cannabinoid therapy which is given also acts through these CB1 receptors. Cocaine. Cocaine is a white powder that is obtained from the leaves of coca plant, Erythroxylum coca. It is commonly called coke or crack. Cocaine causes serious physical and psychological problems, including hallucinations and paranoia. You can see the image of the plant on the left side and the image of the powder of cocaine. The other plants with hallucinogenic properties are Atropa belladonna, from which atropine is extracted, and datura on the right side. Drugs like methamphetamine, amphetamines, barbiturates, tranquilizers, lysergic acid diethylamide are normally used as medicine to treat patients with mental illness like depression and insomnia and are often abused. Tobacco, Nicotiana tabacum, is smoked, chewed and used as snuff. You can see the plantation of tobacco below. It increases the carbon monoxide content of blood and reduces the concentration of heme-bound oxygen, thus causing oxygen deficiency in the body. Tobacco contains nicotine, carbon monoxide and tars, which cause problems in the heart, lung and the nervous system. Adrenal glands are stimulated by nicotine to release large amount of adrenaline and noradrenaline, which increases the blood pressure and the heartbeat. What are the effects of smoking tobacco? Today, due to curiosity, excitement or adventure, youngsters start to smoke and later get addicted to smoking. Research says about 80% of the lung cancer is due to cigarette smoking. Chemicals in smoking. Smoking is inhaling the smoke from burning tobacco. There are thousands of known chemicals which includes nicotine, tar, carbon monoxide, ammonia, sulfur dioxide and even small quantities of arsenic. What are the chemical effects of smoking? Carbon monoxide and nicotine damage the cardiovascular system, and the tar damages the gaseous exchange system. Nicotine is the chemical that causes addiction and is a stimulant which makes the heart beat faster, and the narrowing of the blood vessels results in the raised blood pressure and coronary heart diseases. Smoking and lung cancer. Presence of carbon monoxide reduces the oxygen supply. Lung cancer, cancer of the mouth and larynx is more common in smokers than non-smokers. Smoking also causes cancer of the stomach, pancreas and bladder and lowers the sperm count in men. Smoking also causes COPD. Smoking can cause lung diseases by damaging the airways and the alveoli and results in emphysema and chronic bronchitis. These two diseases, emphysema and chronic bronchitis, along with asthma, are also referred as chronic obstructive pulmonary disease, COPD. What are the risks for smoking? Smoking can damage every part of the body. The cancers that can occur because of smoking: head or neck cancer, lung cancer, leukemia, stomach cancer, kidney, pancreas and colon cancer, bladder and cervix cancer. The chronic diseases that can occur because of smoking: stroke, blindness, gum infection, aortic rupture, heart disease, pneumonia, hardening of the arteries, chronic lung disease and asthma, reduced infertility and hip fracture. Counseling to stop smoking. When a person smokes, nearly 85% of the smoke is inhaled by the smoker himself, and others in the vicinity, called passive smokers, are also affected. Guidance or counseling should be done in such users to withdraw this habit. Addiction and dependence. Addiction is a physical or psychological need to do or take or use certain substances such as alcohol to the point where it could be harmful to the individual. This addictive behavior can be personally destructive to a person. Over time, addicts start to lose not only their jobs, homes and money, but also friendship, family relationships and contact with the normal world. Addiction to drugs and alcohol can lead to a psychological attachment to certain effects such as euphoria and temporary feeling of well-being. Repeated use of drugs and alcohol may affect the tolerance level of the receptors present in the body. These receptors then respond only to highest doses of drugs and alcohol, leading to greater intake and addiction. Excessive use of drug and alcohol leads to physical and psychological dependence. When psychological dependence develops, the drug user gets mentally hooked on to the drug. The drug user constantly thinks only about the drug and has continuous uncontrollable craving for it. This state, called euphoria, is characterized by mental and emotional preoccupation with the drug. Physical dependence is a state in which the user's body requires a continuous presence of the drug. If the intake of the drug or alcohol is abruptly stopped, he or she would develop withdrawal symptoms. In a sense, the body becomes confused and protests against the absence of the drug. The withdrawal symptoms may range from mild tremors to convulsions, severe agitation and fits, depressed mood, anxiety, nervousness, restlessness, irritability, insomnia, dryness of throat, etc., depending on the type of the drug abuse. What are the effects of drugs and alcohol? Short-term effect appears only for a few minutes after the intake of the drugs and alcohol. The abuser feels a false sense of well-being and a pleasant drowsiness. Some short-term effects are euphoria, pain, dullness of senses, alteration in behavior, blood pressure, narcosis called deep sleep, nausea and vomiting. Drugs and alcohol have long-term effects that lead to serious damages because of the constant and excessive use. The physical and the mental disturbance makes the life of the user unbearable and tortuous. For example, heavy drinking permanently damages the liver and the brain. Here you can see the short-term health risks benefits of alcohol, which includes anxiety, sexual difficulties such as impotence, impaired judgment leading to accidents and injuries, slowed breathing and heartbeat, loss of consciousness, suffocation through choking on your own vomit called aspiration, potentially fatal poisoning. The good news is that the short-term effects of drinking are reversible. When you reduce your drinking, the symptoms will improve. On the right side, you can see the long-term health benefits which alcohol can contribute to. Damage to an unborn child, liver damage causing cirrhosis of liver, Osteoporosis, where there is less deposition of calcium in the bones, causing thinning of the bones. Pancreatitis, causing inflammation and infection of the pancreas. Stomach ulcers, infertility, heart disease, raised blood pressure, stroke, dementia, and brain damage. Here you can see the long-term and the short-term effects of the drugs. The short-term effects: inability to sit still or sleep, slowed breathing, nausea and vomiting, dizziness, poor coordination. Long-term effects: memory problems, weak muscles, permanent heart, brain and lung damage, and heart attack. How to prevent and control the usage of drugs like alcohol and other substance abuse? It is practically possible to prevent someone from using drugs and alcohol. Here are some of the ways that help to prevent the drugs and alcohol abuse. We have to effectively deal with the peer pressure. The biggest reason for teens to start on drugs is due to their friends, peer groups imposing pressure on them. Hence, it is important to have a better group of friends to avoid such harmful drugs and alcohol. Seeking help from parents and peers. Help from parents and peer groups should be sought immediately so that they can be guided appropriately. Help may even be sought from close and trusted friends. Getting proper advice to sort out their problems would help the young to vent their feelings of anxiety and guilt. Education and counseling. Education and counseling create positive attitude to deal with many problems and to accept disappointments in life. Looking for danger signs. Teachers and parents need to look for the signs that indicate tendency to go in for addiction of the adolescents. Seeking professional and medical assistance. Assistance is available in the form of highly qualified psychologists, psychiatrists, and de-addiction rehabilitation programs to help individuals to overcome their problems. Alcoholics Anonymous. Alcoholics Anonymous was started in 1935 by a businessman and a doctor who had been a hopeless drunk for many years. After the men helped each other to stop drinking and to stay sober, they then founded the Alcoholics Anonymous to help other alcoholics. Since that time, Alcoholics Anonymous has spread throughout the world. The Alcoholics Anonymous, what does Alcoholics Anonymous do? Alcoholics Anonymous members share their experience with anyone seeking help with a drinking problem. They give person-to-person service or sponsorship to the alcoholic coming to Alcoholics Anonymous from any source. The Alcoholics Anonymous program sets forth a 12-step program that offers the alcoholic a way to develop a satisfying life without alcohol. The program is discussed at Alcoholics Anonymous group meetings like open speaker meetings, open discussion meetings, closed discussion meetings, step meetings, institutional treatment and correctional meetings. Let us move on to the mental health, in which we are going to deal with depression. Mental health is a state of well-being of the mind with self-esteem. Self-esteem means liking yourself and being able to stand up for what you believe is right. Positive mental health is an important part of wellness. A mentally healthy person reflects a good personality. Activities of mentally healthy people are always appreciated and rewarded by the society, as these persons are creative as well as cooperative with others. Mental health improves the quality of life. 6 keys to keep good mental health. Have good social connection with your family members, with your friends, with your relatives. Stay active always. Manage stress and solve problems very easily. Have a healthy diet which is good for your brain. Have good quality sleep and enough duration of sleep. Live a meaningful and purposeful life and involve yourself in daily routine activities, planning it accordingly. Depression is a common mental disorder that causes people to experience depressed mood, loss of interest or pleasure, feelings of guilt or low self-worth, disturbed sleep, poor appetite, low energy and poor concentration. 8 most common causes of depression. There is a change in the brain chemistry and there is imbalance of the chemical substance in the brain. Genetics and biology leading to the hereditary involvement of the depression. Drugs that can cause depression. Day-to-day life stresses, poor nutrition, traumatic events in life in one's growing age and childhood or adulthood, female sex hormones, physical health problems like illnesses. What are the signs and symptoms of mental depression? loss of self-confidence and self-esteem, anxiety, not being able to enjoy things that are usually pleasurable or interesting. Here you can see in this image the signs and symptoms of depression, persistent feelings of sadness, loss of interest in activities, trouble in sleeping or oversleeping, appetite or weight changes, fatigue or decreased energy, difficulty in thinking clearly or quickly, irritability, frustration or pessimism, physical aches and pains, recurrent thoughts of death or suicide. Lifestyle changes like exercise, meditation, yoga, and healthy food habits can help to be relieved from depression. Exercise stimulates the body to produce serotonin and endorphins, which are neurotransmitters that suppress depression. Practicing exercise in daily life creates a positive attitude. Participating in an exercise program can increase self-esteem, boost self-confidence, create a sense of empowerment, enhance social connections and relationships. Brain is the one of the most metabolically active part of the body and needs a steady stream of nutrients to function. A poor diet may not provide the nutrients for a healthy body and may provoke symptoms of anxiety and depression. What is the treatment of depression? You can use medications from the psychiatrist or doctors. Psychotherapy can be given by the psychologist or the psychiatrist. Good communication in the family and social life, doing good exercise, taking healthy food rich in vitamins, planning and scheduling your program daily, doing relaxation exercises like yoga and meditation, traveling regularly to keep yourself relaxed, listening to music, positive thinking, and sleeping enough. So today in Human Health and Diseases Part 8, we discussed about the drug and the alcohol abuse in adolescence and mental health, in which we talked about the depression. So thank you. Kindly subscribe, like, share and comment the channel Read MedPrep Academy. Register for UG and PG NEET type MCQs in our website www.readmedprepacademy.com. Our Facebook ID is Read MedPrep Academy. Our email is readmedprepacademy@gmail.com. Our Instagram is Read MedPrep Academy. Kindly WhatsApp the number given below to join Read MedPrep Academy. Kindly post your questions in the comment box. We will reply with appropriate answers. Thank you very much.